I just want to start by saying that what we've tried to do here today is to try to really present a celebration of all the things that you do across the tripartite mission. So we've worked very hard as a team to put together data and statistics and accomplishments. And so really this is a celebration of all of you. And I've been really humbled and proud to synthesize this data for you that I'm going to present over the next hour. I also want to say that this is an opportunity for us to sort of see from a good vantage point the proverbial elephant. That all of us work in silos and we may touch the tail or the trunk. And I hope this is an opportunity to appreciate what's happening in the clinical environment, what's happening in research, what are the challenges that we face, what are all of your accomplishments, and really share and experience and be proud of that together. Before I start, though, I also want to say a special thanks that walking into this job, I've been amazed by the leadership. Our chairs, our institute directors, our center directors, the camaraderie, the pride, the mentorship that I've received, the optimism, the hunger for change and for growth. I've also received a lot of personal mentorship. Bruce Gerald, Mohan Suntha, Bert O'Malley, Allison Brown is my GVR instructor, and I've taken her on as a personal executive coach as well, and I want to thank her before her retirement. There's been so many people. Al Reese, who's had monthly meetings with me to prepare me for this job. Senior UMB leadership, Susan Buskirk, Greg Ball, Jennifer Lichtman, Kevin Kelly. I spent a lot of time with all of you. I really appreciate that. Elena, way too much time with legal. People in UMMC leadership, like Dana Farrakhan, Marco, Dave Marcosi, Kevin Steer, and then the Board of Visitors. I'll mention all of you later, and I appreciate you all being here. I've just provided such a warm welcome. So with that, I will start. So I think I've shared with you that what I've noted is that we live in a remarkable, rarefied environment. Probably no other geography outside of Boston and San Francisco matches the number of high-powered academic medical centers. From Northern Virginia to Washington to Maryland, Inova Fairfax, Georgetown, GW, Howard, NIH, ARPA, DARPA, HARPA, NIST, HHS, Walter Reed, Naval, Hopkins, the list goes on and on. But we are really the major public university academic medical center. And that really sets us apart and sets our mission apart, and something we can be incredibly proud of. So as you heard from Bruce, I really spent the fall on a number of listening tours and mini retreats. And these would be anything from 60 minutes to 5 hours at IBBR. And I want to thank all of you for taking time from your busy schedules to spend time with me. And as I did these retreats, I met with departments, institutes, centers, programs, students, alumni, staff, colleagues. I also went to dinners with business leaders, philanthropists, leaders in academics, leaders at Hopkins. And a common theme that I heard from many people at these dinners is they didn't really know what we were doing here. They wanted to know more about what we were doing. And so as I went on these tours, I developed what I call my shock and awe slide deck. And I have about 30 shock and awe slides about all of you that I share. But I'll start by sharing 10 of these. But even before that, one of my favorite things to do on the weekend is I'll sit down with a cup of coffee and I'll read the hard copy of the New England Journal of Medicine. And this is sort of my break from doom scrolling the New York Times or the Washington Post. And I was amazed to see how many articles that we author at this institution. In the last year alone, there are 12. And I just mentioned the New England Journal because it's the highest impact scientific and medical journal. And just look at the range of studies that we're leading in this institution. Shock and awe. All of you know about that in January 2022, David Bennett became the first patient in the world, a pioneer, an astronaut, really committing his life to improving the world, was transplanted with a genetically modified pig heart here at UMMC. Bart Griffith has won almost every major surgical award this last year, and you may all not know that Mohammed Mujahideen was named in Nature's top 10 people who helped shape science in 2022. We were leaders in COVID vaccination research, and the Center for Vaccine Development and Global Health led a pivotal study to determine whether adults could safely choose their own booster shot. And I remember reading the study and was reassured that I could mix these boosters safely, so thank you. The Institute for Genome Science ran high-capacity testing 22 hours a day, every day, providing testing at 100 different locations. It's estimated that 20% of all testing for COVID in the state of Maryland was conducted right here. So, congratulations. The Center for Vaccine Development and Global Health is the first center in the world to develop controlled human malaria studies. In fact, in one of these amazing shock and awe tours, the building right next to us, they're actually exposing normal volunteers to live mosquitoes, which bite them. It turns out the female mosquitoes are more aggressive biters, and they're infected with Plasmodium falciparum, and they pre-vaccinate and then look at, by PCR, the time to infection. This type of exposure vaccination study is the fastest way to determine the efficacy of a vaccine. Radiation oncology, because this isn't ranked in Blue Ridge, very few people know about this, but a recent analysis showed this department's #1 in research funding among top US medical schools. We also have a major countermeasures program. We have a BARDA-funded large animal GLP lab that tests exposure to dirty radiation or radiation, really vital for understanding responses and therapy if we're ever to have a dirty bomb or a nuclear war or any sort of medical emergency in that area. We all know about extracorporeal membrane oxygenation, but in 2022, at the peak of the COVID pandemic, our department was #1 in ECMO patient volumes in the US, and despite the severity of the patients we treat, we had the second lowest mortality index in the nation. Focused ultrasound. This is a technology that uses multiple intersecting ultrasound beams to non-invasively target exact locations deep in the brain to create leak or to disrupt a process. And this study, led by Howard Eisenberg, Graham Woodworth, showed that this could reduce tremor in individuals with Parkinson's disease. Studies are moving forward to disrupt the blood-brain barrier, and there's very exciting studies in partnership with Linda Chang looking at whether this could be used to change addiction behavior in individuals. Orthopedic trauma, we're #1 in federal funding for orthopedics, 40 million in grants over 5 years, and among the highest inpatient volumes in North America. And again, this is one of the most cited articles for the year in New England Journal of Medicine, looking at a pragmatic trial of aspirin or low molecular weight heparin for traumatic fracture clot prophylaxis, led by Slobodja, O'Toole, and O'Hara. I was able to visit Lancaster on a tour with Alan Schuldiner. There are more than 10,000 old order Amish in Lancaster who have participated in this research program, more than half the adult population. And this work over years has resulted in the discovery of proteins, pathways, and mutations that affect the risk of developing cardiovascular disease, diabetes, blood clotting, and other cardiometabolic abnormalities. This year, congratulations to the team, we have a 100% one-year graft and patient survival rate, the top living kidney-related, donor kidney transplant outcomes in the region. People don't realize this. So now we'll just dive into some of the numbers across the tripartite mission to really share with you. These may be things you all know, but I didn't know. You know, what's the volume of work? What are we doing? What's going on by the numbers across the tripartite mission? So as you all probably know, we have about 5,000 total faculty and staff. We have more than 2,000 medical students, grad students, residents, and clinical fellows right here on campus. We were ranked by AAMC #9 in research funding among 92 public university medical schools, #27 in research funding among all 192 medical schools. We're ranked on Blue Ridge for 11 departments in the top 20. I'll mention their names later. US News ranked us #11 in research ranking for 92 public universities, and #22 in primary care among all 192 medical schools nationally. In terms of research, I'll just touch on our research funding, our grant submissions, and honor some of our faculty, academic accolades for some of our faculty. So actually the number is really 528 for FY23 in total research awards. What you can see here is that after COVID, there was a drop in funding at 22. This has reflected a drop in COVID funding grants and vaccine grants, but it also reflects the decrease in international support for HIV research trials in Africa. And that's both of those obviously trends are going to continue. So I think 22 is going to become our new baseline, but I was very excited to see that these grants are on the rise, all the hard work all of you are doing. And this is reflected by this 10% increase in the submitted dollars for all grants. Hopefully this is going to continue to result in increased funding for all of our departments, centers, and institutes. These are the 10 departments that are ranked in the top 20 by Blue Ridge, and I'll let you look at those. Now, the Blue Ridge Institute for Medical Research only counts NIH awards. In fact, we're trying to lobby them to add all awards, and this is particularly important to us because, as you can see here, NIH awards only account for 44% of our grant funding portfolio. We have tremendous support from the state, federal grants like DARPA and ARPA and other organizations like that, 14% corporate, and then nonprofit and non-foundation. So the NIH is just the tip of the iceberg of our grant funding success. I do want to recognize a number of faculty leaders who have brought in major programmatical grants. So these are big programmatical grants like U's and DARPA grants, et cetera. So Jim Caper and LaCourse for the big first award, Alan Doctor for the concert award, Drs. Tran, Sawant, and Simone for the Robin Oligomet Center, which also has a lot of AI-based prediction, Dr. White and Maherkar, Dr. Levine. I mention my name only because I want to shout out and thank Kate Autry, Kimberly Curry, and Jamie Dahm, who helped move this grant from Pittsburgh. Now, this is a 22-site multi-center trial with 2 sites in France and sites in Brazil. It's an incredible work to move a grant like this, and this was done so efficiently, and I want to thank the Department of Medicine for helping with this as well. Dr. Berry and Chen, Passetti, and Singh. I also want to recognize our top 10 most funded individuals. I think I saw Dr. Newsel somewhere there. Kevin Cullen, of course, leads our cancer center, but these are 23 obligated dollars. So these are funds that come in per year by these individuals. We have 15 T32 training grants. Now, T32 training grants are a labor of love for the PIs, so I want you to look across the names, really the heroes that are supporting this effort. These T32s support grad students, postdocs, clinical fellows during their research years, and they form the foundation of the base of research development for our early career individuals. And we have 105 trainees covered by this. And one of the reasons I say it's a labor of love, it's a lot of work, it's a huge grant, and there's no effort for the PI. So we're putting in 10% support for all PIs of T32s. We've enacted that already, and we're encouraging other people to put in collaborative, cross-disciplinary T32s, and I know there's a lot of activity in that domain. We also want to recognize R25 and D43s. We have 10 of these. These are educational, international educational grants. Also, we want to recognize faculty accomplishments. Dr. Claire Fraser was inducted in the National Academy of Sciences. I think that deserves a special applause. Her team sequenced almost every human pathogen. We're the first to sequence almost every human pathogen, and that base knowledge has had an enormous downstream impact on therapeutics and our understanding of infectious pathogens. I also want to recognize our 2022 and 2023 distinguished university professors, our entrepreneur researchers, and educators of the year. And we want to recognize Bob Gallo, his legendary scientific career spanning 6 decades. He's now transitioning to Director Emeritus of the Institute for Human Virology. We all know his work in co-discovering HIV, but many people don't realize that he's a 2-time Lasker awardee, the American Nobel. He's one of the world's most cited scientists for the last 30 years. We also want to recognize our endowed professors listed here from this year. And we have these very special endowed professor investiture ceremonies. And I want to thank our academic leaders who have been coming to those ceremonies. And I encourage the faculty to come to these events. It's really a great time to meet with leadership and celebrate the success of our most successful scientists and physician scientists. So what about our clinical care numbers? So we work in a system, the University of Maryland Medical System, which cares for 2 million unique patients with 17 million encounters per year at multiple sites, as highlighted across this map. And this is a very unique patient population we care for, owing to its remarkable diversity. 1 million African Americans, 11.8% self-described other, which is mostly Latinx, but a very diverse population, which, as you'll see in a minute, provides for us unique opportunities, challenges, and really a unique mission. Our faculty practice is comprised of more than 1,200 physicians across 40 medical specialties. We provided more than 1.6 million outpatient and inpatient visits this last year, and we treat patients in more than 90 locations and generated $406 million in revenue in 2022, just to give you a sense of the scale. This is some of our patient care numbers, again, to communicate that scale. 49,000 emergency room visits and 122,000 patient admissions, 150 ECMO cases, 300 plus transplant surgeries, almost 2,000 babies delivered, 3,000 cancer patients treated, 3,000 orthopedic trauma cases, 5,000 plus heart surgeries, 7,500 patients treated by shock trauma, and 21,000 outpatient surgical cases. These are our volumes pre-COVID in terms of ambulatory visits, charges, inpatient volumes, and emergency medicine charge volumes, just as a sense of where are we compared to pre-COVID. And as you can see there, we have recovered from pre-COVID numbers, but we're not exceeding pre-COVID numbers. If you look at most institutions, those numbers are increasing, reflecting the backlog of cancer screening and medical need. So I think this reflects both good news that we've recovered, but also news that we have to increase this activity, that there is a backlog of patient need that we're in a position to provide. Meredith Marr leads our advertising team for the faculty practice, and they're 3 years in a row, they won Best Electronic Advertising, Best of Show. Our faculty have been recognized in different ways. This is the Daily Records Healthcare Heroes for Dr. Hoover, Levine, Bata, and O'Toole, and the Daily Records Top 100 Women of 2023, Dr. Natiri, Khanna, Bird, and Kelly. Congratulations. And we have outpatient primary care and multi-specialties clinics, and our clinic in Columbia, called the Waterloo Clinic, has had an absolute 30% increase in specialty occupancy from 50% to 80%, so we're growing. We were named the best urgent care. This is urgent care run by our family medicine practice, 3 years in a row, and the #1 surgical center in Maryland by Newsweek. We're really excited that the Stoller Center for Advanced Medicine, you can see the construction starting. I think it's impairing the time to walk into work. I'm about 2 minutes late to every meeting every morning. And this is the home to the Greenbaum Inpatient and Outpatient Cancer Center. There's going to be the addition of 3 new floors that's going to be for traumatic brain injury and spinal cord injury. And this will be supported by a new Department of Physical Medicine and Rehabilitation Medicine that's been supported by Mohan Suntha, Umroy, and the Umroy Foundation. So we're very excited about this, and this is a project that Pete Crino and others have been advocating for a while. Education. We have 1,234 total students in the School of Medicine, 147 medical students per year. We have almost 6,000 applicants per year for those 147 slots for an acceptance rate slightly below 4.8%, and we train more than 1,000 residents and fellows. There are incredible events held, and it's been really a pleasure for me to participate in these events, and I want to compliment our educational deans and leaders. They put enormous time and energy into these events to communicate the value statement to our community and our students. This was the student clinician ceremony from 2025, the white coat ceremony for 2026, and the white coat ceremony, I think for 27, and a graduation for the class of 2023. I want to thank Dean Hutchins for recommending Dean Matthew, the George Washington University Law School dean, who gave an incredible keynote speech. Now, these are very important events. There were more than 1,200 students present at the Hippodrome, 300 or more watching online, and people share the YouTubes of these events. So this is an incredible way for us to communicate with our community and, again, share the values of the Academic Medical Center and the University of Maryland at Baltimore. These are some of the highlights of our class of 2027. Again, 149 students. Our class reflects the diversity of our state. 58% women, 80% Maryland residents, 40% coming from College Park. We have 63% that are self-identified persons of color, 15% LGBTQIA+, 24% underrepresented in medicine, and very elite performance, an average GPA of 3.82, 86th percentile on MCAT. I definitely would not have gotten into this medical school when I applied. So. And then after medical school, there's something called the match day. And the match day is when you apply for your fellowship. And that really reflects the trajectory of our students, where they're going, and how competitive they are. So we had 135 senior medical students who matched. And this is the wonderful match day celebration. They're now old enough to drink, so it is a bit of a party. 50% of our students matched to primary care specialties. And that's why our ranking is so high for primary care. 34% stay in Maryland, reflecting the impact we have on healthcare in Maryland, and 35 students at the University of Maryland Medical Center. So this is an important pipeline of talent for us in the hospital. And this is, again, a very elite group. 12 matched at Johns Hopkins, 10 students at Ivy League schools. We have a wonderful medical education program, and I want to thank Maurice Reed, who's sitting in the middle in the front. He not only is from class of 99, he was the founder and CEO of Express Care. He's one of our ER residents and ER faculty before he left us for much bigger and better things. But he's given a major gift to support the rebuilding of the anatomy lab, which allows us to increase our class size. That anatomy lab design and the whole course is run by Adam Pouchet, who's won the Golden Apple Teaching Award 3 times. I think he's the highest recipient of that. Also, Maurice has supported a new point-of-care ultrasound course. You know, ultrasound can now be conducted with a small tool on your iPhone, and it's really been a disruptive technology for the practice of medicine. It's sort of making the stethoscope obsolete, except for wheezing. So it's so important that we remain cutting edge in the technology that we're teaching, so we appreciate this support. I also want to mention our other important programs in the health sciences education space. Our Department of Physical Therapy, led by our chair, Dr. Marchese, has 71 new PTRS students in the class of 2023. We have a Department of Medical and Research Technology. We have 7 master's programs, genetic counseling, public health, and others listed there. We also really value our clinician educators. And Donna Parker created the Medical Education Leadership Academy. The mission of this academy is to foster the career development of a diverse community of nationally recognized leaders in medical education. One of the first academically oriented people that our students encounter in the beginning of their training in medicine are the medical educators. They have the greatest impact. They communicate the value of our mission. And it's often those experiences that attract students to careers in areas of unmet need, whether it's women's health, geriatrics, being a physician scientist. So it's so important what you do in this space, and I really appreciate that. So I like to talk a lot about generational challenges. And when I think about generational challenges, for me it was the AIDS epidemic. Before that it was the scourge of tobacco after World War II. It was the COVID-19 pandemic more recently. And what are the generational challenges that we face together going forward? One is aging. For the first time in world history, 4 years ago, two lines crossed. The number of people over 65 was greater than the number of people that were under 5 in the entire world. So we're facing the gray tsunami. And I think we're very well poised to be leaders in this space, and this is something J Magaziner's been pushing. We have a VA, Geriatric Research and Educational and Clinical Center. We have a Pepper Center grant. We have 2 T32 training grants. And across the school, we have almost $79 million in funding related to frailty and aging. So this is a big opportunity for us. Obesity and the metabolic syndrome. We're facing an epidemic, as you know, of obesity. And this is particularly acute among our most vulnerable, underserved populations. There have been massive breakthroughs in the last year with the incretin pathway modulation, so the GLP-1 agonist you probably read about. But unfortunately, these drugs are going to the wealthiest right now. So I think we have a responsibility and opportunity to bring these drugs, these treatments, to the most needy individuals in Maryland. We are living in a warming, highly connected, overpopulated planet, and that is leading to explosive epidemics of zoonotic infections. It's leading to antibiotic resistance, and it's leading to the inception of a new field of climate medicine. We all experienced that with the Canadian wildfire smoke that we faced for a week. And so I think we have a big opportunity in this area. We have a medical school interest group in this area. And I think with the Center for Vaccine Discovery and the IHV, we're very well poised to be leaders in emerging pandemics. And then 3 other areas, the neurosciences, the brain science, big data, and health equity. I'll just talk about major programs we've launched in the last year that reflect our breaking down silos and partnering to success. So neurosciences first. This last year, the overdose deaths in America are rising exponentially. And for the first time, it exceeded 100,000 overdose deaths last year in the nation, largely attributable to the fentanyl, to deaths from fentanyl. But Maryland has the highest per capita overdose deaths, and Baltimore #1 in the nation for per capita overdose deaths. This is figure right here. I don't know if you can see, there's tiny dots within each streak. Each dot is 3 people who died in the US. And inside the circle from the yellow is Maryland, and in the red is just in the city of Baltimore. And again, here's the data, 174 deaths per 100,000 people. Our rate is higher than Philadelphia, Washington, and San Francisco. So we have a responsibility to tackle this challenge. And so we've created the Collert Institute for Addiction Medicine this year. This institute will focus on basic fundamental science like the GLP-1 agonist in obesity. We have to find some magic bullet that will turn off addiction once it's developed or prevent it in at-risk individuals. When drugs are developed, we need to have phase 1, 2A architecture in our electronic healthcare record to get those drugs out there in pragmatic trials. We need clinical programs and policy, of which we're already leaders in that space, and education and training. Every one of you has to know how to prescribe harm-reducing therapies like Suboxone. And that's been a goal of our med school to make that possible for all our residents and all our students. And so this institute was really catalyzed by an amazing gift from Greg Collert, from the Collert Foundation. This is the largest family gift to the institution. It was a match of $10 million from UMB, thank you, Dr. Gerald, to fund the space and the renovation of the basic and translational space. $5 million from us, from the school. And this is now led by 3 associate directors, and we're starting a search for the institute director. And this again reflects the translational continuity from basic science with Dr. Keller to translational science from Sarah Catacuzzi and Eric Weintraub leading clinical medicine. And this again crosses departments, crosses domains. Basic science, basic neuroscience, division of infectious disease and medicine, and psychiatry. And why are we well positioned for this? Well, first of all, on the upper right, this is a map of Maryland showing our current active addiction treatment programs in county jails, mobile treatment units, and patient care. We have a gorgeous and large addiction treatment center right in West Baltimore by the railway station that I had the pleasure of visiting with a tour from Eric Weintraub. The school has 62 current active grants on all topics related to addiction, totaling $112 million. Work like Mary Kay Lobos, she has $3.7 million in funding per year. And this, for example, is an exciting discovery of hers that rodents treated with fentanyl under a fear stimuli actually have a shrinkage of their neurons. So there's structural changes to the neurons that occur in this setting. How do we grow those neurons back? How do we bend that curve? And Jim Peach knows I love space maps, but to me this shows that this is real, this is happening, this is the actual architectural design of the Collard Institute in the 5th floor. And what's really neat is there's basic labs, but then there's a behavioral animal facility, and then there's human labs right here for translational studies, again reflecting this commitment to translation. Another generational challenge in neuroscience is mental health. We all know about this. 51 million adults experienced mental illness in 2022. Neurodegenerative disease. 5 million Americans have Alzheimer's and related dementias. This number is expected to increase threefold by 2050 based on the aging of our population. Not only is this a scientific challenge, but it's a care delivery challenge. We now have expensive monoclonal antibodies that may bend this curve. People are going to want to know if they have dementia and want to know how to access these drugs, which is a big challenge for our teams in neurology. So we've created another institute. This was a vision of Al Reese's. He made me promise to take this across the finish line, and I'm so glad with the partners. Peg McCarthy is leading this University of Maryland Medicine Institute for Neuroscience Discovery. There's 3 pillars: neurodevelopment and neuropsychiatric disorders, neurotrauma and brain injury, reflecting all of our research in traumatic brain injury, aging and neurodegeneration. And this has been a team effort, again, breaking down silos. So we had financial contributions from neurosurgery, neurology, psychiatry, and physical therapy and rehabilitation, and the dean's office, plus support of slots in the first award, which is a very competitive grant to provide $600,000 to recruit early career investigators from diverse backgrounds. And again, space planning for this entire floor has been set up by these investigators. They put in a CO6 grant, got a 34 or 32 score, so we're crossing our fingers. It might be funded. We may have to put it back in, but we'll keep trying. Big data. All of you are reading about AI in medicine, precision medicine, population health. This is an enormous challenge, opportunity, and it's going to be part of our new reality. Obviously, each patient today has thousands, if not hundreds of thousands of data pieces, everything from medical healthcare records, imaging, wearable devices, surveys, GIS maps of socioeconomic status, multi-omic research studies. And all of this can be integrated and subjected to advanced computing technologies to identify risk, to identify new phenotypes and drive precision medicine. And this has created a challenge. There's been a big series in the New England Journal on this. We have our work by Dr. Goodman on physicians and how we're going to see the change in the practice of medicine as we use clinical algorithms. But also it introduces major concerns about bias in medicine. Most of the large data sets that are used to design AI algorithms come from very homogeneous populations. So I think, again, we have both an opportunity and a responsibility to make sure that we're participating in correcting any race bias that's built into modern tools and AI that will be used in clinical practice. That's our big opportunity here to serve the citizens of Maryland. So we're creating this new institute for health computing. This is really the brainchild of Dr. Gerald and Dr. Pines. I think I remember him calling me as I was walking to Presby Hospital, asking for some ideas on the vision for this, and has been pushing me since the day I arrived to move this forward. This is a unique partnership with the University of Maryland Medical System. Again, 2 million unique patients on Epic, University of Maryland, Baltimore, and College Park. This is supported by $40 million from Montgomery County, which is why we're putting the institute there. $30 million from Empower. It is, I'm not that dumb. $30 million from the Empower Fund. This is the largest single contribution from Empower, and $3 million from a federal grant to focus on building computing there. We have 3 institute co-directors. Brad Marin, we're delighted. We've recruited from Harvard, who's leading this. Sujal Bista from the College Park Size, and Warren D'Souza, who's the Chief Innovation Officer at the University of Maryland Medical System. So these 3 are partnering to see this come to reality. Already we've recruited Rosalina McCoy from the Mayo Clinic to lead our precision medicine and population health program. We've recruited Issa Davis, who's going to be leading implementation trials in the community, and other folks. Martha Jerzak's come from Pittsburgh as our business strategy and business development. And many of you in this audience are already partnering and participating with the idea that you'd bring portions of your team to Montgomery County and as part of that rich organization. And Brad keeps adding people to this list, so forgive me if I've left you out. The space, we've signed the lease. This is going to be at 6116 Executive Boulevard, 27,000 square feet, renovated right before COVID. Beautiful space, and we'll be there. This is close to the White Flint Metro stop. This institute is going to focus on population health, like I mentioned, early detection and electronic healthcare record. We could identify people at risk of overdose, at risk of addiction, hypertension in pregnancy, prematurity. Clinical trials, embedding in the electronic healthcare record, adaptive or pragmatic clinical trials. Data analytics, extended and virtual reality, artificial intelligence and machine learning techniques. Therapeutic target innovation with partnerships with IBBR and Dr. Weber. And then education. We have 2 task forces, Donna Parker and Brad are sitting on 2 task forces that are working to develop a master's in health computing with College Park, and then we're exploring a combined BS, MD 7-year program that would be between College Park STEM and University of Maryland, Baltimore School of Medicine. So what's an example of this? And this is a great example that Kevin Cullen gave me of lung cancer screening. This was a project with him and Warren D'Souza. And they asked the question, what's happened to lung cancer screening, in fact, all cancer screening since COVID? So they're able to pull lung cancer screening. This is a low-intensity CT scan using these billing codes. And they could look at all these different sites within the UMS network. And this is the data pull. What we're looking at, this line is the number of screening studies over a 5-month average. So we're doing about 500 low-intensity CTs every 5 months. And this plummet is COVID. And this happened for all cancer screening in America. Now, for most cancer screening, like cervical, breast, colon, this shot up to higher than pre-COVID levels, and we're doing really well. But for whatever reason, we have not recovered with lung cancer screening. So this now allows us to identify this as a target intervention. And you can only imagine the delay in lung cancer that's going to happen 15 to 20 years from now. And we can look at health equity. So these are white patients, black patients. There's a drop in both. But notice, even though we see equal numbers of African Americans as well as Caucasians, we're doing less screening among African Americans. And the recovery doesn't occur in both. So this allows us to build what's called a learning healthcare system, where we look at lung cancer, we analyze data, we find a deficiency, we target that for innovation, whether it's navigators, e-consults, approaches to target individuals that should be screened, and then adapt our clinical system to protect lives, to save lives. Health equity, one of our major generational challenges, social justice and health equity. So I'm delighted that you all have met Dr. Drake. I mentioned her because Dr. Drake is a world-renowned expert in sarcoidosis research. And I think it's important, if we serve a community like West Baltimore, that we invest in centers and research programs that are relevant to the populations we treat, like sickle cell, like sarcoid. And so she's building a new sarcoidosis program. She's also working with a team of faculty to re-engineer our faculty and leadership evaluations. So we include health equity accomplishments and community service accomplishments within those evaluations. She's also been helping mentor underrepresented minority faculty. For example, under her leadership, we've submitted 12 diversity supplements and already have been awarded 6 just in the last 3 months. These are 500,000 grants to promote careers. Issa Davis just joined us this week. I think I saw her over there. Dr. Davis is a member of the U.S. Government Preventive Service Task Force, an Amos Scholar, funded by the NIH, and an expert in implementation science, trying to target hypertension in pregnancy, smoking cessation. And she has a unique role reporting to our deans of all the schools and to Bruce Jarrell as the Associate Vice President of Community Health. And that's going to be a partner with University of Maryland Medical Center, UMB, and the School of Medicine to try to improve care across West Baltimore. We're very excited about a program we're working on. This is a health village at the Mondawmin Mall. This has been spearheaded by Tim Regan. You can see this was our visit. We have Louisa Peartree, President Jarrell, incognito, Jim Hughes, Dan Bellamy, who's the CEO of Total Healthcare, the Federally Qualified Healthcare Center. You can see Dr. Stewart, and over here Ron Cummings, I think. And so all of our group went out there. But anyway, this is what it's going to look like. It's being built now. I think they're targeting completion in about a year. Very exciting. Independent of that, we also have an effort to develop a partnership with Total Healthcare, which is the Federally Qualified Healthcare Center in West Baltimore. They have 5 primary care sites, and they already refer patients to us for medical and dental care. They have 29% children, 30,000 patients that they see. So we're working with Rachel Hoover to actually create a joint venture with them, a real partnership to deliver care with the support of the HRSA supplemented FQHC support. So I'll now turn to sort of summary of major initiatives across the tripartite mission with the concept of embracing change. I've been amazed by all the projects and programs that are moving along the tripartite mission. And there won't be a test about these things, but I just want you to see this and sort of share my enthusiasm and pride about this. So first of all, new leaders. You know, Chris O'Donnell's been doing an enormous amount of work as a vice dean, working with Jim Caper. I mentioned Bill Regime as our new president of FPI. I mentioned Wonder Drake, Issa Davis, and Brad Marin, but I want to shout out to Dr. Marcosi. He has a dual role now, not only as the chief clinical officer, but also an associate dean. And this is a very generous and visionary idea of Bert O'Malley to have dual reporting. So we're really bringing our faculty and hospital teams together for important mission around value, efficiency, and improving hospital and outpatient operations. Jason Rose is a role as Associate Dean for Innovation and Physician Scientist Development, reporting to both me and Jim Hughes. Rachel Hoover, I mentioned, our new EVP and Chief Administration Officer. She presented today at the FPI exec meeting. Great presentation. Joni Prasad is our new Assistant Dean for Research Development Administration. Heather Culp, I mentioned, leading philanthropy. And again, in the spirit of bringing us together in alignment, she's bringing together the UMMC Foundation and the School of Medicine Philanthropic Foundation. So we're really coming together. Jessica Mongs, Assistant Dean for Graduate and Postdoc Studies. And Scott Steffen has just been selected to be the Associate Dean and Chief Information Officer after a major national search he completed for and won that position. So congrats to Scott. And by the way, this whole thing's working, I think, thanks to him. We have a number of new department chairs. Dr. Bird, who was my first hire before I walked in the door, and she's been doing an incredible job. Peg McCarthy, I mentioned. We have a number of interim chairs. Frank Henn, Gerald Wilson, Dr. Galvano, Lisa Shockett. And I just want to say that all these interim chairs are working to the top of license as chairs, growing, building, fully empowered to execute the mission and doing an incredible job. Dr. Ravel and Dr. Kodalil, thanks to you. We also want to announce just last week, Sean Quatra signed as our new chair of dermatology. We have a department, a proud but small 2.5 faculty department. But with that department, we have an elite residency, we have great success, and we had 20 applications for this chair position. Incredible applicants, just showing how excited people are to work with all of you. He is internationally renowned for his work on inflammatory skin conditions. He leads the Johns Hopkins Itch Center, which he's going to form here. I kind of want him to find a better name than Itch. Anyway, and a lot of energy, so we're really excited about him joining us. So if you look at research initiatives, I'll just briefly mention that we're working to foster large programmatic grants. We have a task force working on NIH collaborative programs. These are physician scientist training programs, shared fellowships. We have a fellowship in hepatology, pulmonary critical care. Al Reese is back from a one-year sabbatical at the Institute of Medicine, and he'll be working with our CAR-T teams to expand the scale and scope of that program, and we're very appreciative of his leadership. Entrepreneurship, this is not only extending to research, but to our clinical domains. I'll mention the new BioE second campus in a minute. We're working on the training pathways, again, the T to K to R. And then Chris and Joni and team have been working on deep dive analytics, compensation, equity and compensation, grants submitted, grants received, space grant density, a lot of the critical analytics to run a very efficient operation. Time to clinical trials activation, time to approval of protocols, all these things that are necessary. And entrepreneurship is something we're really working hard and partnering with Jim Hughes on. As I mentioned, Jason Rose works closely with Jim Hughes, and the goal is to build UMB and the School of Medicine into a destination for entrepreneurial biomedical faculty and trainees. And we're working on COI strategies and very excited about this effort. This is what will be an iconic research tower just across Martin Luther King, 4 MLK. You've seen how fast that's going up. Wexford's building that. And we are going to partner with College Park to build a second bioengineering campus on the 4th floor of that building. And this is a partnership with the Dean of Engineering, Dean Graham, John Fisher, the chair of bioengineering, who's been working with Chris, and Dr. Scarletti is moving his labs here from College Park to help direct that. And there's already one tenure track position that's been opened up. And again, the space has been mapped out. There's actually, this is a model with a vivarium. There's another model without the vivarium because Charles River may move into the bottom floor of that space. That's still being negotiated. From a clinical care standpoint, we've been working very hard on partnerships, as I mentioned, with all of our partners that I mentioned earlier, but also the VA hospital. We have monthly meetings with the VA. We're working on joint faculty appointments. We'd like to work with them in all leadership positions. And right now we have multiple shared searches that are launching. I mentioned dual reporting. We're also recruiting a senior vice president for ambulatory services that would be at Midtown and UMC that again would report to me and Bert, working with Rachel and Bill Regine. We have new compensation models rolling out in 4 departments: pediatrics, family medicine, internal medicine, and neurology. And these compensation models are designed to reward our physicians for the work they're doing to increase compensation. We're working very hard, and this is a challenge in the post-COVID era, on hospital clinic efficiencies and improving quality outcomes. We actually leave a lot of money on the table with GBR that we could capture with improving our quality outcomes on readmissions, length of stay, et cetera. So this is going to be a very big focus of Marco's in the next year, and resources are being put to have faculty leaders at key inpatient areas. Cancer Center Director recruitment's ongoing, and we're very focused on access and keepage. We want your incredible care to be available to all the patients in Baltimore, all of us on campus, and we want access to our outpatient clinics. We've focused mostly on inpatient medicine, and most of the world is moving outpatient. So this is a big opportunity and a big priority for us. And we want every patient to be a VIP. I'm looking for a day when someone calls me and says, "Can you get me into a rheumatology clinic?" And I say, "Just call our call center number. You'll be in 2 weeks." So we've revised, it's been a busy year. Skip Rose and others have helped. We've revised FPI bylaws. We've consolidated our access center. We're expanding advanced practice provider partnership models with all of our departments. And again, we're focusing on improving physician compensation through shared E&M revenue, increasing access and keepage, and again, incentives to value outpatient. So in those 4 incentive plans, we're adding new patient visit incentives. Because seeing a new patient is a lot of work, as you all know. So we've also worked on improving data analytics, and Rob Selby has done a great job of creating data pools, and I've been torturing all the chairs, as you know, when we meet together. But this is some of the data we look at. This is 6-month data of new patients, time to see to be seen as a new patient in our faculty clinics. And you all are doing an incredibly good job. 52% of patients are seen within 2 weeks. And I'm not sure people know that. Now, obviously, we want to move this tail to the left, but some of these are routinely scheduled, late visits. But again, this is success and an opportunity for us. This is the kind of data that we analyze, the mean time for a new patient visit. This is a really important piece of data, that the percentage of patients that fill our Epic templates. And it's 70%, and that's low. We would like that to be 100 patients, right? That 100%, that every slot is full. This is a 30% capacity opportunity. This would sort of be like running our airplanes at 70% capacity. And this is 21% new. Again, an opportunity maybe to see more new patients with this capacity. At the same time, if we're going to increase the template density and increase the rewards for seeing more outpatients, we're going to have major operational challenges, and we're thinking about the downstream flow of patients into cath labs, cardiac imaging, interventional radiology, hospitalization. But also we have to think about physician wellness and burnout. I've done a lot of clinic, a lot of Epic typing, and Epic has really gotten between us and patients. So we're very excited about this new AI chat box-driven technology. And I don't know how much you've read about Nuance. We just had an emergency IT meeting with all of our teams from UMS, from UMMC, and from FPI. And we're very excited. This is Joe Klein on the screen taking his daughter to college. So this is a very committed member of your team, Mohan. But this Nuance tool looks like it's ready for prime time. It's a device that sits there, listens to your interaction with a patient, and constructs a note. And it's reducing documentation time by 50%, reducing burnout and fatigue, and patients feel that the relationship, it's getting us back to the old days when we actually looked at our patients and talked to our patients and didn't type. So we don't want to be late adopters, we want to be cutting edge early adopters, and we're launching a pilot with 10 physicians within the practice. In terms of educational initiatives, I mentioned efforts to increase class size, increase scholarships. Donna Parker's working on a very innovative program with the University of Maryland Eastern Shore to create a track for health equity, to expand the medical size, to have rotations on the Eastern Shore, a health equity track and rural health track. We're also working on these combined programs that I mentioned earlier. One of the big things that's consuming a lot of our time, and I appreciate the work that's being done, is preparing for the Liaison Committee on Medical Education accreditation visit, which happens in April 15 to 17. There's a group of more than 150 faculty, staff that have been working on this. More than 1,000 hours have been put into this. We've revised bylaws, updated annual faculty review processes, streamlined appointment processes for volunteer faculty, and developed a strategic plan. All of this required for this reaccreditation. So thank you for your hard work on this. Website. I've heard so much comments on our website that we have to improve the website. This is really important because this is what people see, our recruits, our students. In fact, we had 1.5 million unique visitors, which is a 98% increase. 10,000 pages, but we have broken links, faculty profiles out of date, large images that are slow to load. So we're working very hard, and we're starting, this is led by Larry and his team, but we're starting on the student trainee recruitment so that we're ready for the waves of students that are coming in. And this is just an example of the new look of this. And we're working with all the departments to make this a reality. From a philanthropic standpoint, I already mentioned the recruitment of Heather. We've already raised $40 million in total giving, and this doesn't count the contributions to the Stoller Tower and the Institute for Health Computing. We have a recent anonymous gift that we thank Bert O'Malley, Pete Crino, Graham Woodworth, and others that have led that gift. And I really want to thank our Board of Visitors. A number of you are here in the front. You have provided such a warm welcome. The Board of Visitors focuses on providing strategic advice to the dean, on engaging philanthropists, on engaging politicians, making key introductions, and on spreading the word about all the exciting things that we're doing here. And I'm so appreciative to all of you for the warm welcome. In particular, Cynthia Egan had me and Tammy over to her house for this lovely dinner. We've been over to Dr. Taylor's house, and thank you for that, and to Dr. Chacon's house. And we just really appreciate that warm welcome. We had 2 dinners even before I started here on August 4th. We've also been involved in system-level strategic planning, and for the first time ever, the faculty practice and the School of Medicine have partnered with the University of Maryland Medical Center on a strategic plan. We've also, of course, partnered in the UMB strategic plan, and we're at the tail end of our own grassroots engagement strategic plan. So this is a summary. Dana Farrakhan, I think I saw Dana here. Thank you. Dana has herded the cats on this big effort, but this is very exciting because this is a strategic plan for the hospital that reflects our mission, the goal to revitalize the West Baltimore community, to advance research. For example, a major piece of this is the time to clinical trials activation in cancer. It's part of the strategic plan, accountable to the board of UMMC and the learning healthcare systems within the strategic plan. But also efforts to how can we best redesign the clinical enterprise. And one of the things that's emerging from this is we want to make sure that we are growing those rare therapeutic areas that only we can provide in the state of Maryland. And so tiers of priority have been created. And the top tier would be programs that really need to grow, like cancer care with the new Stoller building. Neurosciences. Today, the era of TPA is over. Our interventionalists are removing clot with catheters. We have to make that life-saving intervention instantly available, the way door-to-balloon time has been for cardiovascular disease. And we have great programs here. Cardiovascular services with our cardiac surgery, our transplant surgeries, that has to grow. And then we have a unique opportunity, as you heard, in living-related kidney and liver transplant. We want to grow those programs. And then we have a strategic plan to improve the health in West Baltimore, focus on chronic diseases, psychiatry, addictions. These are things that need more support and investment. We also have to optimize these programs, all organ transplant, perinatal care, shock trauma, and pediatric heart. And some of the strategies, we have to identify conditions that could be handled in the community setting that might not need to be here at a tertiary quaternary care referral site. And this is a big challenge. What are these things that can create beds for growth in these critical areas? We've also done our own grassroots strategic planning. Wendy O'Donnell has led this. This is Generational Challenges in Maryland Medicine. This is a logo they created for the strategic plan. It's lovely. The vision is to be a leading clinical education and biomedical research institution that actively pursues solutions to generational health challenges impacting our local communities and society. This process has involved grassroots faculty brainstorming. I'm sure most of you participated in these. Prioritize meetings then with either elective or selected representatives to prioritize the notes and lists from those grassroots meetings, and then working groups to create a strategic prioritized document. Now, this process is amazing because 85% of our faculty participated. 951 people participated in this. It's really quite remarkable. 42 brainstorming sessions, and Wendy is still standing, and I want to thank her for this. And while we haven't finished the analysis, because you all are going to do that analysis, I wanted her to share with me the themes she heard. And these themes are things we're not waiting on, we want to address. And some of the themes, interestingly, I think a lesson for all of us is collaboration, particularly our young people. They feel that with COVID, they're not networked. They don't know what's going on. They haven't seen the entire elephant. So we need more engagement. So we're creating the win-win group that are getting together, and Jason Rose is leading that. So please encourage your faculty to participate. People have raised questions about protected time, the perennial challenge. How do I have protected time to teach? Protected time for research. People have asked promotion and tenure. They want a more holistic process. They want us to recognize community contributions, recognize contributions to health equity, recognize new types of publications, social media, or internet-based publications, or impact in a broader sense. And a lot of concerns about wellness and burnout, which we see across the span of medicine, especially in a post-COVID world. And probably the number one thing that comes out, and we hear you loud and clear, is operational efficiency. People want efficiency, clinic efficiency, clinical trials activation efficiency, hospital efficiency, OR efficiency. And I'll say we're absolutely committed to this. We work on it every time. I think Kevin Steer and Marco and Bill Regine are on constant text and meetings about these types of issues, and Chris O'Donnell is working with Susan Buskirk all the time to make major improvements, and we're very excited about the trajectory and the rapid response that we're seeing around these areas. So you all will have to be patient with us, but we're absolutely committed to this. This kind of efficiency can really unleash your creativity and your productivity. So in conclusion, I just want to summarize the themes that I've discussed, just things to think about, and your role, addressing or being part of this vision. So one is we want to address generational challenges by aligning our efforts across the tripartite mission. We want to break down silos with innovative translational centers and institutes, and that's clinical and basic and education centers of excellence. We want to advance and nurture fundamental science and fundamental and clinical science. We want to embrace the potential of big data and information technology for precision-oriented patient access and population health, and address disparities in medicine. We want to harness the power of data analytics to target resources and improve performance, operational performance across clinical research, education, and philanthropic missions. We want to enhance our pipelines or our pathways to train and recruit in areas of unmet need. We want to empower and support our providers and faculty by increasing these operational efficiencies. And we want to lead the fight for social justice, health equity, diversity, and integrity in science. So these are some of the values of an academic medical center, and I'm so proud to work in a major public university academic medical center. If you think about it, our academic medical centers are temples of diversity, of enlightenment, and they're probably one of the best things that has ever been created in America, maybe outside of the Tesla, are our academic medical centers. And I'm so proud to be here. And I'll end with this quote, one of my favorite quotes: "Whatever you can do or dream you can, begin it. Boldness has genius, power, and magic in it," by Goethe. And I want to thank this team. This was at 9:30 on Friday night, working on slides. Everybody had to cancel the weekend events, and I apologize for that, but I promised we can pretend Labor Day is next weekend. And this is right before I left the room. So I'll thank you all. There's going to be a reception at the HSF3 atrium. Please come. There'll be food and there'll be drinks. And we have a slideshow that all of the departments and centers and institutes have given us slides of exciting discoveries, faculty accomplishments. I've also downloaded my iPhone of all the quirky photos I've taken with all of you over the last year. So there should be a good slideshow that will sort of cycle every 20 seconds. So thank you.